Hi, Dr. Sandeep. I have heard that men can get breast cancer. Doctor, is this true? Could you please explain it?
It's a very interesting question because very often when we diagnose breast cancer among men, people are taken back because they never thought that men can get breast cancer, but men also can get breast cancer. 1 in 100 breast cancer patient is a man. Now looking on the other side, in the general population, for women, lifetime risk of getting breast cancer is, you could say somewhere around 1 in 4. That's about 25%. Whereas for men, it is 1 in 1,000. So it's a very, very small risk. But still, men can get breast cancer. Now, are there men who are at a higher risk of breast cancer? Typically, men with breast cancer, we need to have a very, very high suspicion of a genetic mutation. There are a list of genetic genes which can cause or genetic damages or DNA damages which can lead to breast cancer among men as well. That includes the most common, the BRCA1, BRCA2, which you people keep hearing everywhere. There are others as well. So, a family of BRCA1, BRCA2 mutation in the gene are at a higher risk of male breast cancer as well. They also can get prostate cancer at the same time. So, apart from this, if a person has been radiated for some reason, radiotherapy for some reason for the chest wall, those patients are also at a higher risk of breast cancer. Other than that, a family with lot of breast cancer patients or a close relative who had a breast cancer also increases the risk of breast cancer among men. So there are many other reasons which we can think of. There are some syndromes, what we call, there is something called a Klinefelter syndrome. There are many conditions, other conditions which can make a male prone to breast cancer as well. Now, how different is the treatment if it is men? Actually, the fact is it is not much different, but every person requires surgery. Most often they require chemotherapy. Also, radiotherapy in many cases. Most of male breast cancers are hormone receptor positive breast cancers. Hormone receptor positive is a good thing in cancer because it is possible to control the disease after all the treatment with a simple tablet. There is also a segment of breast cancer, male breast cancers, which will be helped by removing the testicles or what is called as orchidectomy. Because remember, testis is an organ which secretes an hormone called testosterone, which can stimulate the formation of breast cancer as well as progression. So there are slight differences in the treatment in this form, but overall the treatment remains the same. The line of treatment is similar or same in most of the situations.